Chapter 9. Memory is susceptible to distortion. Memory trace is the physical record of a memory made in the brain by a learning experience. It does not deteriorate from disuse or time. Each time a memory trace is activated during recall, it is subject to changes and fluctuations. Combined with new info, we can start to recall distorted memories. Misinformation effect is the susceptibility of our memory to incorporate false details that fit in. It is very easy to implant false memories, and planting false memories clouds the issue of recovered memories of childhood sexual or physical abuse. Flashbulb memories are vivid, detailed memories of a momentous or emotional event. Two of these events are John F. Kennedy's assassination or 9/11, where people can remember exactly where they were or what they were doing when they heard the news. Self-reports of flashbulb memories, like other memories, are unreliable. They can be faulty even when we strongly believe they are accurate. There are 7 sins of memory. Omission is blocking, absent-mindedness, transience. Commission is bias, leading question, misattribution, and persistence. How can you improve your memory? Repeated retrieval of stored information. The potential for changing retrieved memories makes them susceptible to distortion. Recall is enhanced when new material that we must learn and remember consists of related information. See how various bits of information fits together is important to understanding the info. Activation connections in semantic webs. Mnemonic devices. Methods of helping to memorize information. Chunking is the breaking down of material into smaller number of chunks, reduces the total number of items to be memorized. Can put info into pleasant-sounding bursts to make it easier to memorize. Method of loci is a mnemonic device where each item of a list is imagined in a separate location in a familiar place, draws upon our knowledge of the room in a house or shops on a street, has imagined each of the items in some list to be memorized as an occurring in a separate location. Recalling each event in an absurd story offers a sequence of cues to retrieve info. Tip of the tongue phenomenon is when we feel we can almost say aloud the word we are trying to remember. And Freud's advice is if you cannot remember the name, say random names. The name one is trying to recall will be related to the so-called random word. We store lots of info, so forgotten info might just be hard to retrieve. Different forms of long-term memory. Clinical conditions that impair memory are scary, but we learn much about memory by seeing where it fails. Not cases where info fails can be consolidated from Cases where info failed to be consolidated from short-term memory to long-term memory. There are different types of amnesia. Amnesia is a severe impairment of memory. Retrograde amnesia is amnesia for events occurring prior to an event, typically a trauma. Not uncommon after surgery or trauma. Princess Diana's limo driver cannot remember what happened in the final few moments before the crash. Patient HM is Henry Molaise, a patient who, because of bilateral medial temporal lobe damage, he could not form new, explicit memories. The case provided clear evidence that short-term memory of the sort we use to carry on conversations differs from long-term memory needed to learn new facts, including facts about someone you've just met or are getting to know. Anterograde amnesia is amnesia for events occurring after an event, such as trauma. The hippocampus is required to put some memories into long-term memory elsewhere in the brain. The medial temporal lobe is the innermost portion of the temporal lobe, which includes the hippocampus and the neighboring cortex. The hippocampus is part of the limbic system that is crucial in the formation of permanent memories. Henry and similar patients have difficulty reproducing or recognizing pictures or spatial patterns, even when not asked to recall them in verbal terms. Declarative memory is explicit memory, facts or information required through learning that can be stated or described. Non-declarative memories or implicit memory is a memory about perceptual or motor procedures that is demonstrated by performance. The previous experience aids in the performance of a task.